ILC biopsies different from other breast cancer biopsies? Imagine trying to find a tiny, sneaky pattern in a fabric that blends in perfectly. That's similar to how invasive lobular carcinoma, or ILC, can be tricky to detect and diagnose. ILC starts in the milk-producing lobules of the breast and spreads in a single file or diffuse pattern. Unlike the more common invasive ductal carcinoma, which often forms a noticeable lump, ILC can grow quietly and spread out, making it harder to spot on regular imaging tests like mammograms and ultrasounds. Now, when it comes to biopsies, which are essential for confirming a breast cancer diagnosis, the basic technique is usually the same whether it's ILC or other types. Most often, doctors perform a core needle biopsy, where a hollow needle is guided into the suspicious area using imaging tools like ultrasound, mammogram, or MRI. Sometimes, if the area is difficult to locate or if more tissue is needed, a surgical or excisional biopsy might be done to remove a larger sample. However, because ILC tends to grow diffusely and may not from a clear lump, detecting it with standard imaging can be more challenging. This means that in cases where mammograms or ultrasounds don't clearly show the abnormal area, additional imaging like magnetic resonance imaging, or MRI, might be used. MRI can help identify areas that are hard to see with other methods, guiding the biopsy more accurately. Sometimes, if the suspicious area is only visible on MRI, an MRI-guided biopsy is performed, which involves using the MRI to precisely target the tissue for sampling. Once the tissue sample is obtained, pathologists examine it under a microscope. For ILC, they look for characteristic patterns of cancer cells growing in single-cell lines and often test for the loss of a protein called E-cadherin, which is a hallmark of invasive lobular carcinoma. This helps distinguish ILC from other breast cancer types and guides treatment decisions. It's important to understand that the biopsy process itself, using a needle guided by imaging, is generally the same for ILC and other breast cancers. The main difference is that, because ILC can be more diffuse and less obvious on initial scans, additional imaging steps may be necessary to locate the cancer accurately. This might mean performing more advanced scans or using MRI guidance to ensure the correct area is sampled. After the biopsy, the tissue is analyzed in the lab to determine the cancer's specific features, such as hormone receptor status and HER2 status. These details are crucial for planning effective treatment, whether it's surgery, hormone therapy, or other options. The process remains consistent across different types of breast cancer, but the unique growth pattern of ILC can sometimes requiring a more tailored approach to detection and diagnosis. In summary, the core biopsy procedure for ILC is not fundamentally different from that for other breast cancers. The key difference lies in the detection process, which may involve additional imaging techniques to find the often subtle and diffuse growth of ILC. This highlights the importance of specialized imaging and expert pathology to ensure an accurate diagnosis. If you or someone you know is facing this, always consult with healthcare professionals who can tailor the diagnostic approach to the individual's specific situation. Remember, each breast cancer case is unique, and personalized care is essential for the best outcomes.